And as part of that, we will release a landmark report on the extent of medication errors in modern healthcare systems, as well as the NHS's plan to tackle them. Alongside those in the report, there are 3 areas of potential medication error that I wish to update the House on today, where serious concerns have been raised by patients and their families. The first is Primodos, a hormone-based pregnancy test which is claimed to have led to miscarriages and birth defects during the 1960s and 70s and was prescribed to more than 1.5 million women before it was withdrawn from use in 1978, partly due to more modern pregnancy tests becoming available. The second is sodium valproate, an effective anti-epilepsy drug which has been definitively linked to autism and learning disabilities in children when taken during pregnancy. Campaigners have suggested up to 20,000 children may be affected. And the third is vaginal mesh implants, often used in surgical interventions to address complications after childbirth, which have been linked to crippling, life-changing side effects. Of course, our first thoughts are with the individuals and families whose lives have been turned upside down by these issues. Many have endured and continue to endure severe complications and a tremendous amount of pain, distress and ill health, alongside a strong sense that their concerns have not reached a satisfactory resolution. I pay particular tribute to those who have responded to such experiences, not just with understandable anger, but also with a resolute determination to campaign for change on behalf of others. Many of them have met ministers and members of this House to share their concerns, and I thank everyone who has written or spoken to me personally to raise these concerns on behalf of their constituents. We must acknowledge that the response to these issues from those in positions of authority has not always been good enough. Sometimes the reaction has felt overly focused on defending the status quo rather than addressing the needs of patients. And as a result, patients and their families have spent too long feeling that they were not being listened to, making the agony of a complex medical situation even worse. So today, in addition to practical steps for each of these 3 cases, I'm also setting out plans to establish a fairer, quicker and more compassionate way of addressing issues when they arise, bringing different voices to the table from the start and giving individuals and their families a clear path to answers and resolution. In terms of immediate action in each of the 3 cases, on Primodos, I've asked my ministerial colleague Lord O'Shaughnessy to drive forwards and, where possible, accelerate the recommendations of the expert working group, further strengthening our systems for monitoring the safety of medicines in pregnancy. This will include offering the families of the Association for Children Damaged by Hormone Pregnancy Tests a full, up-to-date genetic clinical evaluation, better information for pregnant women and their families, better training and support for obstetricians, better evidence around dosing recommendations, making electronic yellow card reporting available directly to clinicians and patients at the point of care, and stronger and more joined-up messages on safety. On Valproate, this issue is broader than the UK, and the outcome of the EU review expected in March will strengthen our regulatory position. In preparation, we have tasked system leaders with delivering a rapid, coordinated response. Directly responding to calls from patients, we are introducing a new warning symbol on Valproate packaging, updating NICE guidance on Valproate, pushing for Valproate to be contraindicated for women of childbearing potential not using effective contraception, strengthening alerts across all GP systems and community pharmacy systems, and for those women for whom Valproate is an effective treatment, offering stronger and more tailored advice on risks and contraception.